This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Most of us have experienced back pain at some point in our lives.
When we talk about the spinal disorders, we talk about the bones, the disc, the muscle of our back. So there are a lot of possible causes of back pains and neck pains. When it comes to the spine, we have possibly scoliosis. We also have like disc problems. Those patients who have slip disc, or what we call your disc bulge or disc herniation.
Most are caused by sprains in our tendons and muscles, especially after lifting heavy objects, not maintaining good posture while sitting and sleeping, and not having the necessary back support.
Well, if you've been experiencing some back pains or neck pain, definitely it is important for you to seek consult and find out what is the real cause of your back pains.
But sometimes the pain persists, even after treatment and therapy. Be wary. Backache can sometimes be a symptom of other diseases, such as infection of the spinal column, tuberculosis of the spine, and other spinal deformities and conditions. While all these complications may be quite terrifying, these disorders can be prevented. All you have to do is follow smart habits in maintaining good posture to make sure your back is on track at all times. How can you better take care of your back? How can you keep your back strong and flexible? What kinds of exercises can you do to improve posture and overall wellness? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Jose Bonifacio Rafanan, a rehab medicine and the chairman of the Physical Medicine and Rehab Department at the Medical City. Also with us is Dr. Larry Acuña, a fellow of the Philippine Spine Society and a spine surgeon from the Medical City. And last but not the least, Dr. Romel Fernando, a fellow of the Philippine Spine Society and a spine surgeon from the St. Luke's Medical Center. You may join our discussion by calling our hotline at 548-4678. Good evening, doctors. Good evening, gentlemen.
Yes, good evening.
Welcome to the show.
Yes.
We're going to be discussing spinal concerns, how good posture can help in overall well-being.
Yes.
But before that, we'd like to know the role of our spine in how your entire body functions. So let's start with Dr.
Well,
Rafanan.
we always say the spine is the framework of our body. So it is actually where our limbs are attached. So we need to have a very stable spine so that, of course, our limbs will tend to function better. So it's a very important aspect when it comes now to doing a lot of our day-to-day activities, like even sleeping. We need to make sure that our spine is actually in the proper posture, proper position. When we're sitting, we're standing, when we're walking, when we lift, when we bend. So this posture of the spine is a very integral aspect when it comes to these movements.
Dr. Romel?
Well, basically, so he already mentioned a lot of it. Because your spine connects your upper extremity to your body, and the objective of your upper extremity is to manipulate objects in air. The objective of your lower extremity is to ambulate or to allow you to be mobile. So because they're connected to your spine, they're connected to your back and your torso, it does have that important function. That's why it has to be healthy, it has to be well-maintained.
And a healthy, well-maintained spine means that we're able to do all these things that Dr. Rafanan mentioned.
Yeah.
Isn't that right, Dr. Larry?
That's right. The spine is a very complex structure. it houses the spinal cord and the nerve roots, and you have to protect that. That's one of the function of the muscle. You have to have a strong muscle, well developed, to protect your spine. So.
And how do we protect the spine so we're able to do all these activities that our day-to-day life requires?
Well, one way is, of course, trying to maintain the proper body mechanics that is needed when it comes now to doing certain things. And of course, in order for us to have a proper body mechanics, it's very important that we do exercises, okay, maintaining, of course, the balance between the abdominal and your back muscles, as well as, of course, the proximal hip and that of the proximal shoulder. And these are what we call the core muscles of our body, right? So when we say core muscle, it's not simply just looking into your abdominals and into your back muscles, but practically the muscles surrounding now the back. That includes the hip and that also the shoulders.
Because when we talk about our back and our posture, we only just literally focus on this area.
Yes.
We don't realize that it also entails looking at the front, the front
yes.
part of our body.
And even the upper part of our body. So it's very important that we look into all these things because they're interconnected. And if one aspect is weak or very tight, then it will actually affect the rest of the body.
So having good posture, does it always mean that, like what you just like what you mentioned, that it's healthy, it's strong, we take note of the front and the back. Good posture, does it necessarily translate to a healthy, strong back? Dr. Larry or Dr. Romel?
Yeah, usually you have a good posture. You develop certain balance, and you have developed strong muscles to have a good posture. So yeah, it goes like that.
Well, usually it's going to be the effect. No? If you have a very healthy back, then we would expect that you will have a relatively good posture. But not necessarily all patients or persons who have good posture will have a healthy back. So, but it's usually a result. No? So having a good posture is a result of having a very strong and healthy back.
So it doesn't necessarily hold true that if you see someone with good posture, then that means they're healthy.
Not necessarily. Not necessarily.
And vice versa, with bad posture, does it necessarily?
Well, chances are if you do have a bad posture, that it means that, of course, you have problems on your back. And this is something to do with your the muscle balance, as well as, of course, the spinal column. So in relation to your disc, there are actually a lot of structures found in our spine that will contribute now to the alignment of the entire body. So we look into the bony structures, we look into the disc, we look into the muscles, into the nerves, right? So all these things can contribute to a good posture or even eventually a bad posture.
You mentioned the alignment,
yes.
And when when it's misaligned, that's the time that we suffer from back pain. Is that true, Dr. Ramel?
Well, when you talk about alignment, the spine has what we call natural curves, right? So your thoracic spine, which is where your ribs are, it is hunched over. So it's called kyphosis. That's the technical term. But basically, that's where you're hunched a little. And then it balances out in your lumbar spine, which is here. Alignment just means that your center of gravity, when you draw a straight line from the top going down, it sort of just falls into place. So why is this important? Well, because one, when we are upright, when we are walking on two legs, it's important to maintain your balance. So maintaining your balance, it's important that you maintain the natural curve of the spine as well.
So my thinking is it's really straight, but there's a natural curve
Yes.
to our
Yeah.
spine
Yeah.
that helps in making us stand up straight or sit up straight. But when this curve experiences back pain, what happens? What causes this? Even if we try to sit up straight, shoulders back, why do we experience pain?
Well, sometimes when we see patients with back pain and they give us an x-ray, the natural curve actually is, it becomes a straight spine. So that's because of the muscle forces that are pulling on the spine and that's possibly what's causing the pain. So anytime you see somebody with back pain in an x-ray that has what we call lumbar straightening, kadalasan yun yung dahilan kung bakit sila in pain. In other words, if this patient were able to relax, if this patient suddenly lost his pain, he would have an x-ray taken, magiging normal na yung curvature niya.
So, kailangan pumunta talaga first to the doctor, but to family members, Dr. Larry, na makakakita to someone na medyo hunched maybe or complaining of back pain?
Yeah, sometimes when you have pain, the natural curve will be different, no? Nag-lean towards the left or to the right. It happens when you have yung nerve, naiipit siya. So you try to protect the nerve, so magkaganon ka siya.
So you move to the left and to the right. Bakit naiipit ang nerve? Is it a bad habit that we have that when we sit down, when we sleep, when we stand up, that contributes to this ipit in the nerve?
Well, in a way, yes. Mainly because if you keep on doing the same thing, okay, the monotony of your work, as well as doing, of course, a lot of static positioning. So this is commonly seen in those who do a lot of office work. So when they're seated for long periods of time, and of course, if their sitting is not in the right way, they tend to slouch, and slouching tend to put a lot of stress into our back, not only into the muscles, but also to the disc, to the joints of our back. And this eventually will lead to back pains. So it always boils down to having a good posture, proper body mechanics, even when simply just sitting down. Even if you're sitting and you're not supposed to slouch, right? So when you're seated, this is the perfect way of sitting. So you're exhibiting one.
Thank you for teaching me before we went on here, Dr. Rafanan.
The best thing is if you're sitting and you're not actually leaning on the chair, right? It is very important that, of course, you try to cross your legs. Okay, for females, you do that, of course, like as you were already showing, is that there will be crossing of the legs and one knee is lower than the other. And this will try to bring your pelvis in an upright position, which tends to actually improve your alignment. If you try to put your knees together, like your feet and knees together, then that will tend to cause a lot of lurching this way. So you end up having a bad posture. So the only way you have to put your knees together is when you're seated fully, right, and your back is well supported. And in this particular position, then you have a very relaxed posture. Okay? However, if you really need to lean forward, okay, then it is very important that you move your body forward and one leg becomes lower, and this will be this side or the axis where you rock your body. So you maintain a straight back rather than curling your back, and that tends to cause you a lot of back pain. So bottom line is, of course, body mechanics.
So body mechanics is a bit complicated if you're not used to it. If it's, personally, it's easier for me to slouch.
Yes.
When watching TV or sometimes even during the show. It's easier for me to slouch than to remember the body mechanics so that I don't get back pain in the end or at the end of the show or at the end of the activity that I'm doing.
Well, it's always a struggle, but again, if you keep it a habit, then it becomes a natural thing for you to do.
And speaking of keeping it a habit, I know our viewers will have a lot of questions when we come back, so we'll talk more about back pain when MedTalk returns.
Did you know that men are most likely to suffer from backache compared to women, since they are more prone to put a strain on their backs? In fact, nearly 80% of men will experience back pains at some point in their lives.
We're back here on MedTalk, still talking about back pain. This time, doctors, and to our viewers, let's talk about scoliosis and back pain. Does it automatically mean that if you have scoliosis, you have back pain? And what is scoliosis?
Actually, the two are not always related. Scoliosis, basically, ang ibig sabihin ng scoliosis, there's a deformity in your back. Commonly nakikita siya sa mga adolescent, diba? So mga teenager. Commonly nakikita siya sa mga babae. Commonly yung curve ay right-sided. Marami kaming makikita na may scoliosis pero hindi necessarily nagba-back pain. And the opposite is true also, no? Marami naman nagba-back pain pero pag tingin mo sa x-rays nila, wala naman silang scoliosis. Yung scoliosis, kaya siya binabantayan is because takot ka na mag-progress yung curve. So merong sinusukat to na angle and you have to monitor kasi kapag tinatamaan niya ay isang batang tatangkad pa, so teenager, di ba? Imbes na tumatangkad, tumatabingi lang yung spine nila. So yun yung kailangan mo agapan and eventually baka kailangan operahan.
So more common siya sa babae.
Yes.
Females more than
Yes,
males
females
and
more than
adolescents. Why is this?
Actually,
Clary.
the ratio is 1:1. But yung pag-develop ng scoliosis, those patients who come to the clinic is 1:6, 1 male to 6 females. Kasi sila nag-progress. More progression is more on the females. Pero halos pareho lang yung incidence. Pero yung severity, mas severe sa females. And with regards to back pain, yung back pain kasi it's a late sign of scoliosis. Usually pagkabata, walang back pain yan. So if you have scoliosis and back pain, kailangan you have to dig deeper. Papa-MRI mo, iti-check mo kung anong nagko-cause ng back pain. Kasi sa scoliosis, most commonly, nakikita namin yung back pain sa mga adult.
So sa adults na lumalabas yung back pain. In
Yeah, for
adolescents, is their
scoliosis,
posture lang
it's
that you
just like a
notice?
posture lang.
Kasi I remember in in high school, it was a very common complaint.
Yes.
That, I have scoliosis, I have back pain, others wouldn't be able to function or go to school because of that. Has it lessened in this day and age, or
Well,
is it still
not
the same?
necessarily.
Dr. Rapanan?
I would say so. But what is important is mainly knowing that this scoliosis happens during the teenage years, is that it is very important that we screen our patients or our children, in fact. So in the school, there should be a program wherein they have to screen now for scoliosis, knowing that this happens during the early teenage years. No? So once they go into high school, right? So we need to screen these children whether they are at risk or they have already scoliosis.
Why does this happen? What happens to the child during their formative years, their growing up years, that nagkakaroon sila ng scoliosis when they reach adolescence?
Well, your guess is as good as mine. It is usually called idiopathic. When we say idiopathic, is we don't know what really tends to be the cause. However, if we always look at it, then chances are we have to blame the family. So there seems to be a genetic or familial disposition. Some would even say that possibly there could be some environmental factors that could have led to the scoliosis. But these are just hypotheses. Okay, but most likely there's a very strong familial tendency. So at times you have to ask whether there are members of the family who are actually with scoliosis.
So you do get it from your family members, and
If you're from the same gene pool, it tends to follow that. So yung idiopathic, it's usually the most common. May mga tao, they have inborn, meaning may problema sa buto, there's a defect, and it causes the curve progression. So there are different types, and that's why kailangan sila i-screen, because kailangan ma-differentiate mo sino yung progressive, sino yung lalala talaga yung curve as opposed to somebody na non-progressive or benign yung curve. So once you've isolated the ones who are progressive, sila na yung pwede mong tutukan.
So for example, minana mo yung scoliosis mo na progressive. Does it necessarily follow na the family member that you inherited it from also has progressive scoliosis?
Actually, we call it idiopathic kasi it's unknown. Sometimes we connote it as multifactorial. So maraming pinanggagalingan, maraming theories. So, yung familial is only 10%. Yung genetic predisposition is only 10%. So, yung ibang factors, di natin alam. So,
but the other factors are factors that we see, we know upon screening, we find out how to address properly.
Yes.
In this the model that you brought, nababend ba yan, Doc? Just to see lang, nababend ba siya? Just to give an example as to yung a typical curvature of someone who has scoliosis.
Yeah, yung scoliosis is hindi siya uniplanar, isang ganyan. So naka-rotate pa siyang ganun.
Oh wow.
Okay.
Oh.
So it's a three-dimensional, we call it three-dimensional deformity. It's yun, ganyan, tapos naka-rotate pa siya. So when we correct it three-dimensional correction also.
Okay.
Yeah. So nakaganon yung scoliosis. So ang kaya minomonitor yung scoliosis per se is not a disease, it's just like a deformity. Ang ayaw natin mangyari, yung outcome ng scoliosis, if it's more than 70 degrees, naipit na yung lungs, no, yung ibang internal organs. So merong we tell them it's a Cobb's angle. So yun yung parang pang-measure natin, pang-monitor. Kung hanggang kailan si Dr. Rafanan therapy or brace, or kailan niya ibibigay sa akin para operahan.
So you refer to Dr. Rafanan kung kailan ibibigay sa akin. How does the dynamics of rehab medicine and spine surgery work?
Well, we really,
in relation to scoliosis,
yeah,
yes,
we
Doctor.
really work hand in hand with the orthopedic surgeon when it comes to management of scoliosis. But as you already mentioned, if this is a severe form of scoliosis wherein the risk of progression is very high, then chances are this patient would really warrant a surgical intervention. However, more often than not is during the early teenage years of these patients, or early years of these patients, we usually put them on exercise and bracing. So we put them on a brace that will try to correct now, of course, the scoliosis and preventing it from getting worse. So we have a good rate of success when it comes now to correction, okay, of this scoliosis in the considered what we call conservative manner. So putting them on an exercise regularly, and the brace has to be worn like 23 hours a day until, of course, skeletal maturity has been reached. So if the patient is like 13 years old, right, we wait until she's 18 or 19, wherein the skeletal system is already matured, right, then there's a time that we can actually discontinue wearing the brace. And that's the reason why you were saying that this is a conversation piece in high school, because some of your classmates may be wearing those braces.
Yes, others wear braces, and that's an extreme case already, but others who can just go to rehab, physical therapy, then that is their option in order to alleviate the pain or correct the curvature.
Yes.
The problem with the brace sometimes is because you affect teenagers, adolescents. They're very conscious about their appearance. So minsan nagkakaproblema kami sa sumusunod ba sila, sinusuot ba yung brace. And again, you know, when you say 23 hours, diba, it's a long time to wear the bracelet. But most of the success stories about non-progression of the curve, kailangan talaga suot na nila yung brace. And it's very common that over the years, ina-adjust because syempre, tatangkad, tataba, papayat, no? So the brace has to be constantly adjusted.
That's right. Doctors, we have a caller on the line. Hi, Lex. Good evening.
Hi, good evening. Hello.
Yeah, hi.
Good evening.
Yeah, please go ahead with your question for our doctors.
Yes, I have a question. This happened about 6 to 8 years ago. I was doing, kasi I live a semi-active lifestyle, and in one of the sports I was doing, biglang I felt a sudden surge of electricity sa back ko. And then from then on, I couldn't walk properly for about 3 days. I couldn't stand up. So I was bedridden for about a week. Tapos parang this happens every year or 2 years na I would be doing these physical activities. What do you think should I do kaya talaga dito?
Okay. Well, looking at the history of legs is that chances are with the shooting pain going down to the legs and with difficulty in walking during the first few days from the onset of injury,
then most likely he ended up with nerve impingement at the lower back. And most commonly, for persons who are very active, it's due to a slip disc or a disc bulge. So, and this tends to be recurrent, especially if you try to do things that tends to make the bulging of the disc more evident. And doing bending, lifting, okay, tends to actually may aggravate now those back pains. So what I would recommend for him is really to do some exercises that will try to balance the back and the abdominal muscles and try to maintain the proper body mechanics when he has to do some lifting or bending when he goes to the gym. So it's very important that he tries to avoid exercises that tends to curl the back, because curling the back or bending it tends to actually aggravate now the symptoms of your slip disc and nerve impingement.
One exercise that you can recommend to Lex? One you can do
a very
at
simple
home, maybe.
exercise, in fact, when it comes to your slip disc, is lying flat on your tummy. So, okay, and then trying to bring your upper body up, pushing your body up like that. And that tends to sort of like hyperextend the back. Now, of course, in the early stages of the condition of like a slip disc, it may be a little bit painful. So simply just lying on your back will be suffice. But eventually, if you can push your upper back, then that tends to actually lessen the pressure on the disc area and pushing it a little bit forward, right? This is to just lessen the pressure on the disc.
Do you recommend? Yes, Doctor.
Yeah, I was just going to say that, well, I guess it's always important that Lex actually sees a specialist, a doctor, because, well, I guess it's a phone call, so we're working on limited information. So to be able to treat him properly, to make sure we cover everything about his pain, it's also important that a doctor see him, he be physically examined, because we can miss out things when there's just a conversation piece about, I have back pain, I have shooting pain, and I guess that's my point in doing this now. Although everything that Dr. Rafan has said about the disc herniation, that's all recommended. And just to add as well, disc herniations can be treated conservatively, meaning nakukuha siya sa pain relievers, therapy, rehab. There's a very small population na kailangan operahan, but kadalasan naman nakukuha sila sa therapy and rehab.
So it's a start that they address their pain and you know, call our hotline, talk to our doctors, and then see their doctors. So we'll talk more about back pain, how to take good care of your back when MedTalk returns.
Want to ease that nagging pain on your back? Why not shed off your excess weight? Did you know that every pound you carry hurts you in some way? A lighter body translates to less extra weight on your back that you have to lug around. The secret to our strength, power, and mobility lies in how well we take care of our backs.
Basically po, dalawa pong klase ng back pain, no? Yung back pain na axial or yung talagang andun na sa likod. Pangalawang back pain naman po is tawag natin dito is radicular. Ito po yung back pain na galing sa likod, tumatakbo po yung sakit pababa sa paa.
If you are already experiencing an onslaught of pain on your back, you must consult with a professional, since it might not be a simple case of backache, but a manifestation of another spinal condition. Treatment options vary depending on the condition.
So, pag hindi po patay ang haba ng paa, mas maiksi po yung isa. Ang tendency po is magkaroon tayo ng pelvic rotation or tatabingi po tayo. No? So, kung tumabingi po tayo, magkaroon po ng tinatawag natin na spasm or mag-contract po yung muscle sa likod na mag-cause po siya ng chronic or pabalik-balik na back pains. No? So itong machine na ito po sa likod ko, siya po yung nag-measure kung aling paa po ang maiksi at ilang centimeter po ang kanyang kulang.
Lower back exercises can fortify muscles and increase blood flow.
Ito yung Williams flexion exercise, ito po yung pag-stretch ng mga paralumbar muscles, no? Para ma-relax. Kasi po ang pinaka-common talaga ng cause ng back pain is sobrang higpit o tight yung paralumbar muscles.
Other machines and muscle stimulators are also used to treat backache and other related conditions.
Kala natin pong parang common back pains lang, no? Pero hindi natin alam na malala na pala ang ganitong klaseng condition, no? Na maaring mag-lead sa total na pagkaipit na mag-lead sa paralysis ng dalawang paa, no?
Indeed, conquering back pain is possible as long as you engage in corrective measures and start off with new healthy habits as early as possible.
We're back here on MedTalk, still talking about back pain and other spinal problems. Healthy habits. That's what the video saying. Now let's talk about how we can improve our posture by way of a demo and some tips from all doctors.
Yes, we already mentioned the proper way of sitting, right, if you have to be unsupported. But the more common problems in terms of having back pain is when you have to bend and when you have to lift, right? There are different techniques that we can actually do. Right, so for example, you lose grip of your pen, right? So how do you pick it up? Okay, in this, can you demonstrate? Yes, okay, doing that. Okay, and definitely this put a lot of stress on the back here, and that tends to put her at risk of having low back pain, muscle strain, and even possibly a slip disc.
Well, just from picking up
an object, more so when you're seated, because you're not supposed to pick an object while seated. So if you tend to drop your pen, you need to stand up, right? And then, of course, it's either you do what we call a golfer's lift. A golfer's lift is just bending your trunk with a straight back and lifting this up here. Okay, that's the proper way of bending. Of course, if the object is kind of heavy, right, then there's a time you have to bend your hips and you bend your knees in lifting this object and raising it up. Okay, for one thing is like, when you're seated, right, the amount of stress that you apply on your back is like 60% than when you are standing up. And when you bend forward, it becomes 80%. And when you have to twist your body, that becomes almost 100% increase in the stress in your back. So it's very important that we address the proper posture when we have to actually lift things. So what about if you try to decide to lift the table, right? Then of course you might probably have to do it in a semi-kneeling position. Okay, so when you have to carry certain stuff, right, then of course you have to bend your knee, okay, and carry this stuff and lift it up. And as you can see, as you try to lift it up, you make use of your big muscles. This is your thigh muscles, your butt muscles, in trying to carry the heavy stuff. So instead of bending your trunk like this way, then you put a lot of stress on your spine, and when you have to lift it up, then you also make use of your spine muscles. So you're not using the bigger muscles then. So it's very important that we have to lift things, then we have to bend your hips, bend your knees with a straight back.
That's a lot to remember because a lot of us, it's easier to slouch, it's easier to lean forward when picking up something or when lifting something. But like you demonstrated earlier, there's even a leg lift that goes into picking up a lighter object when it falls on the floor.
That's what we call the golfer's lift.
Okay, I'll take note. Everybody get that? Golfer's lift. Okay, now after picking up things from the floor, standing up. What is the proper posture when we're talking to someone or
when it comes to, of course, standing or rising up from the chair, it's, if there's no armrest, right, you can make use of your lap, okay, and try to push your body up as you try to go up, okay, standing up, especially when you are sitting in a very low chair, right? So if the chair is too low, you tend to slouch, right?
Yes.
And then we tend to bend forward and push our body up like this in trying to, of course, rise up from the chair. However, okay, again, bending the trunk would tend to cause more stress on your back, especially if you try to do it quickly. So for us, it's very important that you move your body, okay, at the edge of the chair, right? And then, of course, your feet wide apart, right? One can be forward than the other.
Okay.
And then use your hands, put your weight on your lap as you try to push your body up like that.
Okay. Oh,
and
that's
that
not
lessens the stress on your back. And of course, persons with back pain tend to do that, in fact.
Okay, now sitting down. Now we're standing up.
Well, the same thing though. Okay, so when we're about to sit, is that of course try to put your weight on your lap as you try to sit down like that.
Okay.
Okay.
Oops.
Okay.
I think
Although of course for the ladies, yes, one leg forward.
Okay.
And then of course try to do as if you're doing a squat. Okay, put your butt backwards. Okay, as you try to sit down and maintaining a straight back.
So these are tips or reminders that we can do when we're in the,
Okay,
the
when
office, when we're seated the whole day,
Yes.
when we are watching television
even possibly during driving, right? When you're driving, so what is the best thing for you to do is the back should be arched, not 90 degrees. Okay, the seat, it should be angled around 110 degrees. So around 20 degrees more tilted towards the back. So that's the right angle when you have to actually do some driving. Now, of course, if you're driving a car, then your tendency is you're sitting in a low chair, right? So you tend to have to make sure that, your knees are leveled, and when you have to push, like for your accelerators, it's easy access, okay? If you tend to extend your knee when you have to, of course, press on the accelerator or the brakes, then you know that your chair is too far, right? Or your seat is too far, so you have to move it closer so that as the chair, so when you're pedaling or when basically pressing on the brake or on the accelerator, is that your knee is slightly bent.
Okay, so it makes it easier for you to do that motion
Yes.
of stepping on the accelerator. Doctors, we have another caller on the line, Edwin. Hi, Edwin. Good evening.
Yes. Good
Hi.
Good evening.
Hi, your question for our doctors.
I was diagnosed with lumbar spondylosis some 5 years ago. I had gone to several therapy, but the pain persisted. What do I have to do to prevent the pain?
Okay,
Dr.
so let's explain certain terms first.
Yes,
all right?
please.
So he mentioned lumbar spondylosis. So lumbar is an area in your spine that is roughly your lower back. So that's this area right here. When you say spondylosis, it just means na nag-arthritis na yung mga buto niya sa likod. When arthritis happens in your lower back, that's when the nerve can become compressed or impinged, because there are overgrowths of certain soft tissue that can pinch your nerve. Undergoing therapy in rehab is usually the recommended thing to do. And usually it's a combination of pain relievers, activity modification, and therapy. If he does not get better, what we do is we take the proper imaging, which is an MRI, sometimes an X-ray, and then we try to isolate aling area sa likod niya yung naiipit. And then, kung hindi siya mag-respond sa conservative therapy, in other words, kung hindi siya mag-respond sa regimen na pinrescribe ni Dr. Rafanan, and that's when there's an indication na sulatan niya si Dr. Acuña, o sa'yo na tong pasyente ko, baka kailangan ng operahan.
Right. So from here, from my right to my left is the way to go, so to speak,
Yes,
in
yes.
taking care of your spine and making sure na God willing, hindi na umabot sa surgery kung maagapan ka agad. But
Yes.
kung kailangan then, to alleviate the pain and to make you more mobile, then surgery is your best bet, no? Edwin?
Yes,
Still on
ma'am.
the line? Oo, you have any other question?
Last year, I was diagnosed with a cervical spondylosis.
Cervical.
Okay.
Cervical spondylosis.
All right. Well, anyway, cervical is just another area in your spine. So when you say cervical, it means the neck, right? So it just means ang pinaka-mobile area kasi ng spine natin, yung lumbar, which is your lower back, and your neck. Diba? So dahil siya yung pinakamadalas gumalaw, siya rin yung pinakamadalas tamaan ng arthritis. So cervical spondylosis and lumbar spondylosis, these are very common conditions. Pareho bang kailangan operahan? Again, the answer is no. You can first start with conservative treatment and then work your way up to more aggressive measures kung kailangan.
Okay, thank you, Doctor. Edwin?
One other question. Can I still play, say, tennis or golf?
Can he still play?
Can I still play tennis?
Tennis or
and
golf? Ah, okay. Can he still play tennis or golf?
Well, again, no, it's hard to make a definite call in this setting. I would feel better if he actually saw someone, because if I tell him no, and I'm working with limited information, it's very difficult. Most of my patients, I tell them, saan ka ba komportable? Up to what level can you play? Because there's such a thing as competitive play, and there is yung parang backyard or yung laro-laro lang talaga. So I guess on his part, no, he could probably just start out something, not too intense, non-competitive, and then work his way from there.
Okay. Thank you very much, Doctor. Salamat, Edwin.
Yeah, okay. Thank you very much.
You're welcome. Doctors, a question from Twitter this time. What's the difference between osteoporosis and scoliosis? Dr. Larry.
Yeah. Yung osteoporosis kasi, it's the brittleness of the bone. So usually it happens postmenopausal among women. So yun yung pinaka-common. Yung scoliosis kasi yun yung pagkurba ng spine, which is commonly among adolescents.
So parang two sides of the spectrum,
Yes.
no?
Yeah.
Postmenopausal and adolescent, no? Does it hold true that if you have scoliosis as a teenager, you will develop osteoporosis when you get older?
No, there's no connection. There's no connection. Osteoporosis is very common among postmenopausal women, so usually 65 years old and above, and also in men, especially when they are in their 70s.
Okay. So osteoporosis, the bones become very brittle,
Yeah.
Yes.
and that's why we like.
Tend to have a fracture, okay, if there is osteoporosis. And that's the reason why it's very important to treat osteoporosis so that we can prevent these patients from ending up with a fracture.
But we can't prevent aging, and
We can't.
we can't. No? Unfortunately, we can't. But we can
But
prevent
you're
osteoporosis.
defying aging.
But we can prevent.
We can prevent it.
Osteoporosis. But we can prevent more about, talking more about back pains, how to take good care of our back and our health. We'll talk more about that when MedTalk returns. We're back here on MedTalk, still talking about backache, back pain, and other spinal problems. Now we have a question from Facebook. We'll go to our question on Facebook in a little while. But A personal question, you know, girls carry a lot of things inside their bag. And at the end of the day, you feel that hindi na pantay yung shoulders mo because you have so many things inside your bag. How can you help us? How can you help the women and the men as well, no?
Well, in carrying stuff, you try to balance it. So the most ideal way of carrying things is trying to keep it closer to your body and at the center of your body, in fact. Now that will somehow minimize what we call the shifting of your center of gravity. Right, of course, if you're carrying, let's say, a heavy bag on your right shoulder, you tend to actually bring your shoulder up like this to compensate, right? And that tends to cause now spasm, okay, and tightness of certain muscles, and that ends up with having back pains. So some would even recommend that probably wearing backpacks could help, because knowing that the backpack is at the center of your body or center of your spine, then somehow it minimizes the risk. But again, posture has an integral role when it comes now to having now a good having back pain. So some would tend to use a backpack, but they tend to shrug their shoulders, they tend to round their shoulders, and that tends to cause them back pains too. So when you have to actually maintain a good posture, right, you have to bring your shoulder back, right? And definitely that, in fact, improves the chin. You know? So we have a chin in position, right, when we are in an upright position. So if you try to bring your shoulder backwards like that, then you know that your chin goes with it. If you try to round your shoulder and round it, then your chin tends to go forward, and that tends to cause a lot of pain over the neck and the upper back. So again, so the proper posture is very important when it comes to carrying bags.
Okay, thank you for that. I will keep that in mind. Backpack would come in handy without a lot of things. Girls tend to carry so many things, just in case things. Doctors, now we go to our Twitter question this time. What kind of mattress is best for someone who experiences back pain? Which sleep position is best?
Exactly. Okay, so
yes, doctor.
For one thing is that when it comes to the position, the type of mattress, as long as it is a firm mattress, then it's good. So it should not be sagging, right? Too soft, because you tend to curl your back when you're sleeping in a very soft bed. So some would even say that you make use of an orthopedic bed, right? So meaning to say that there is a very firm mattress. It's either a mattress or just a spring coil or like your, so those stuff. No? When it comes to the proper position of sleeping, well, there is no such thing as proper position though. You can curl up if you want, if you sleep like curling up. Some people sleep with on their tummy, some sleep lie flat. Okay, so it doesn't matter much though. Some would even question whether how many pillows should I use in sleeping. Okay, it doesn't matter either, right? Mainly because as long as your back is fully supported, right, then that should not be a problem.
Okay, it's also not a problem if your pillow is too soft or your pillow is too hard. Doesn't matter. As long as your mattress, that's the most important thing.
Yes.
Okay. Dr.
Well, I was just going to say that sometimes you just have to establish what you're comfortable with when it comes to the sleeping position. The firm mattress obviously also helps, but with regards to ano yung specific position mo, it really depends on what you're comfortable with. So a lot of people toss and turn. They start out in one position, end up in another, and so in the morning they still end up with some sort of pain. Ano?
Yes.
So it's very common. I mean, kahit naman kami mga doktor, we experience the same
Do you experience
things.
back pain?
Yes.
Okay. Okay.
I'm primarily because when you're a surgeon, you tend to stay in one position for a prolonged period, no? And you do it over the years, over the days, and obviously you get a lot of pain. So sometimes when there's a break during the surgery, you just look up because most of the time you're looking down.
Right, and it's the neck that gets strained.
And your lower back as well.
Yeah. And that's the reason why we, at times, we tend to actually blame the pillow, the bed, the sleep. But of course, sleeping is like 8 hours, and the rest of the day is 16 hours. And you need to find out what have you been doing for the past 16 hours that tend to cause now those neck pains and back pains, which usually would be manifested when you're sleeping or when you wake up in the morning, right? So the key there is, the main issue will be, of course, what have you been doing for those 16 hours that you are awake that tends to trigger now those neck pain, back pains of yours.
So just don't attribute it to the last 8 hours.
Yes.
Because you had a whole day of doing so many things.
That's right.
That might have contributed to the pain that you feel. Dr. Larry, any last words for our viewers in taking good care of their back and some reminders?
The sleeping pattern is actually not for the back pain, but most of the patients would complain about neck pains when they have using high pillow. So what I tell to my patients is that at least your head and your shoulder should be in the same level. No matter how high is the pillow.
Neck and shoulder should be on the same
shoulder
level when you
head.
sleep. So tonight when they all sleep, you will remember what Dr. Larry has just advised you to do, and when you wake up in the morning, you'll feel refreshed and vitalized. Thank you very much, Dr. Larry. Dr. Romel, any last message?
We're all gonna get back pain and neck pain. It's very, very common, and majority of the time it will go away on its own. Majority of back pain does not you can actually neglect it, it will go away, but the problem is it does tend to come back. And that's because of our lifestyle, right? We do a lot of sitting, repetitive lifting, twisting, bending. So it's really just about taking a mental note of these are the activities that trigger my pain, and these are the activities that help relieve it. And with the help of your doctor, we can help you itemize that list.
Thank you very much, Dr. Larry. Dr. Afanan, last message.
Okay, maintaining the proper body mechanics will be very helpful in trying to prevent now having back pains. Doing regular exercises also will definitely be of help. So what is the most important thing to do is prevention, right? Prevent having those back pains by proper body mechanics, by doing regular exercises. And even if you do have some of these pains, then as mentioned, seek, consult, and verify what is the cause of your back pain.
Thank you very much, Doctor. Thank you, doctors. We'd like to thank Dr. Jose Bonifacio Rafanan, Dr. Larry Acuna, and Dr. Romel Fernando for helping us understand more about back pain. We will all have it at some point in our life, but we must address it properly, treat it, and hopefully we can prevent it from coming back. See you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night, everyone.